I forget.
How did we forget already?
Should have brought it with us. It was Marina. It was. What was the other one? Everyone, welcome to another episode of A Little Unbalanced. I'm Cassie and this is
Vanessa.
And today we are coming to you from the beautiful bush. That sounds hilarious.
The beautiful bush.
Our beautiful bush.
No. Nature's beautiful bush. Not Cass's.
Not mine. You don't want to go down. No. So if you can look behind us, you can see that the sun is shining. It's starting to feel a little more like fall. So we've got our sweaters on. It's sweater weather.
It's beautiful.
Yeah. And we're going to talk to you guys a little bit about Women's Health Day, all of the things that women have to put up with.
Yeah.
Yeah. So we're going to kind of do a little bit of a conversation around the IUDs. So all of these things that we have to do to our bodies, biopsies, mammograms, and just whatever comes up as we discuss, and just basically all of those things that as women we have to endure because we are female. Yeah. Yeah. Did you want to add to that, Vanessa?
No, you were perfect.
Okay. So just
per usual.
Oh, thank you. Perfection. So just to start off, we wanted to talk to you about just how unfair sometimes the system can be in regards to women's health. And we'll talk to you about our own experiences with these items. And then we would love for you guys to comment or to let us know what has worked for you, what hasn't. And if you have just a ridiculous, funny story, or maybe, a traumatizing story that's come up for you in regards to these topics, we want to hear, we want to share, and we want to create a space for everybody to chat and talk. So I think the first thing that we were kind of talking about was a more painful procedure, and that was getting a biopsy done.
Yeah.
Do you want to maybe kind of explain what that would look like if you're somebody who's never had a biopsy, and what are some of the reasons why you might need one?
And I feel like it's different per practitioner.
Yeah.
So when I went in to an OG, so he was a specialist, he emphasize the he
yes
part.
This is important.
They didn't tell me, I went in to just do assessment, and in that moment he was like, oh, do you want to do this, and I was like, sure. So he was going to do PAP because he said that I didn't have one recently, which was a lie, and he blamed me for lying, or accused me of lying. So we had, during the PAP, he was like, do you want to do a biopsy? And I was like, sure. And so it'd be a good idea to do it. They didn't explain anything to me.
Oh, that's awful.
And I was like, okay. I was already spread eagle table, exposing it all. So he went in there, and so they go in and they take a little clamp. Well, this is my experience. I don't know. Pretty sure this is the average. They went in with a little clamp, and they clamp your cervix, and then they go in with a little scraper, a little tool, and they cut tissue off to send out for biopsy. He was in there pretty fucking long, I felt.
That's horrendous.
And I was in, I was getting back pain. I wasn't informed that you bleed after, so I wasn't prepared to be bleeding after. They didn't give me anything for the drive home afterwards. So I was, it was not a nice experience, and he wanted to continue to scrape more, and the nurse had to stop him and say, I think we have enough.
Jeez.
And then she kicked him out of the room and was like, okay, go check on your other patients, and let's give her a minute. And she stayed with me just to make sure I was okay, because I was crying.
Because she, one, has a vagina, two, knows that this is a procedure that you need to explain prior to doing it to your patient, and have a little courtesy to explain that it's probably going to be painful. That's horrendous.
Yeah, it wasn't. So it wasn't, I found it really painful. When he clamped, I didn't feel anything.
Getting weight in there, sorry. Just a bug.
You don't want to dig down in there? Sure.
I could, maybe later.
I'll watch a video. There won't even be a bug there.
Oops. No.
So what was I saying? I got excited and you felt me up.
I'm sorry.
But yeah, so he didn't explain anything. He didn't tell me anything. When they went in there and clamped, I didn't feel anything really. And he was like, oh, you're doing good. And then the first couple scrapes, I was like, oh, that, you feel it.
Yeah.
I was getting back pain, which is weird. and then like cramping, and then he kept fucking scraping. And then it was like, okay, we're done. And then he pulled it out and he took his little vial thing and he's like, I think we need more. And the nurse was like, no, I think we're good.
Yeah.
So that was my experience. I know your experience wasn't as traumatizing in that department, but you do have a different story because there's more to yours.
Yeah. So thank you for sharing that, because you just like brought to light all of the things that sometimes, especially when you're a female going to a male practitioner for care, and not always, I've had great male practitioners, but for the most part, I've had similar experiences with men.
How are they supposed to really understand? That's like going to a therapist for anxiety and depression and panic disorder, and for somebody that's never had that. They can't fully grasp like
how it feels in your body. Well, and I think too, like for so long, people thought that there were no nerve endings in that area. So for like years and years and years, women weren't given pain medication to manage these types of procedures that have to do with our delicate areas, because they felt like they didn't need it.
Yeah.
And that we were just exaggerating on the pain, right? And that goes like with all of the other female issues. And we could talk all day about that, but we won't. So when I was really lucky, I pushed to go to a gynecologist that was not here where I'm from, but it was in the city, and it happened to be a female, and it was just like the luck of the draw, right? And I was so grateful to have a female doctor, because when I had my children, I went from a male to a female, and so I knew the different type of care that you got and just the consideration for your body and explaining procedures. It seemed like there was a lot more care. So when I went to Edmonton and I dealt with my gynecologist, she did some really great things, and she did some not so great things. So the first thing that she did was she explain the procedure prior, and I'm a teacher, so I do a lot of research into all things. So I knew that I was going in for a biopsy. I knew what the process, I knew that there was going to be pain and bleeding after, so I came prepared with a pad.
Yeah.
And you didn't know that, so you didn't have anything.
I was having a biopsy either, right?
Which is wild. And so they should have given you things and talked you through what could happen after the process. So I knew that going in, and so I was mentally prepared, and that's a huge thing, especially if you're a woman who's experienced trauma or you've gone through things in your life. You kind of need to mentally prepare for those procedures as well, and just to know what it's going to look like after. So you explained it really well, where they essentially take their tool and they pinch your cervix, and then they are scraping. So for me, I was actually on my period at the time, and they say that is a good time to go in, which sounds counterintuitive.
I feel like it wouldn't be as painful then.
It's not as painful because everything is just kind of relaxed, and something to do with the hormones going on in your body. So it's less painful. So I was lucky in that way. Right? However, I was at this stage where I was having incredibly heavy flow. So it was super uncomfortable, because here I am spread eagle on this table and things are leaking and you can feel it. And so the lady went in and she was really kind, and she talked about what was going to happen, what it would feel. You're going to feel pressure. She was very considerate of my needs, and she was in and out. And so I think having a female who's gone through the process herself and spoke to that was really helpful. And I felt like she was a pro at this, and she knew what she was doing. And she just didn't, there was no joking, there was no messing around. It was just like, she's just going to explain it, and then she's going to go through. So when she put the clamp on, it felt just like pressure. And when the scraping started, I did feel pain. And then afterwards, I noticed that moving forward, I did get some cramping. So I got some pretty major cramping, but like I had said, I came prepared. And so I had pads and I had bleeding already. So it was just uncomfortable, where after the process was done, I had to like bunch up the towel under me and try not to make a mess. You know what I mean? There's discomfort there, especially if you're going in during that time of the month. But the thing that I was not impressed with was, while I was splayed out on the table, she talked me into getting a Mirena IUD. And prior to going in, I did not want to get a Mirena, because I had done a lot of research into it, and I kind of wanted to go more of a holistic route. And so I was hoping to have that happen. Do you want to pause? Nope. Okay. So we just have some people in the background, so bear with us. But we sorry, I lost my train of thought there.
No, at that time when you're spread.
Yeah.
The Mirena, convinced you to do the Mirena.
Yeah. So she was convincing me to get this, and I already had in my head that I didn't want to do it, but being on the table, splayed out, just going through this procedure, I was pretty vulnerable,
Yeah.
right? You just want to get out of there. And so she chose that instead of, prior to going into this, as the opportunity to sell me on this. And like, had I been in the right mindset, I probably would have said no, but I said yes, because she had told me that she had one herself and it worked for her. And I've heard both good stories and bad stories, but when it's bad, it can be really bad.
Yeah.
So the IUD itself can travel and it can perforate. You can get heavy bloating, which I'm now experiencing, really severe cramping, which I've also experienced for the first 3 months, and some people onwards. And so anyways, I just thought it was a really terrible time to be doing this to somebody when they're already so vulnerable. And they're just essentially, all I wanted to do was for her to get out of the room so I could get off the table and to move on with my day, because I was already feeling overwhelmed. So the purpose of the biopsy, obviously for both of us, was to check to see if we had cancerous cells or anything that they would have to do further follow-up with. So you're already in the headspace of, okay, well, I'm a little nervous about this, right? Like, I want to know what's going to happen next. And so you get in your head, and if you have anxiety like me, you want to go in and just be prepared. So that's another thing I find, is that push to put in an IUD, even though they know it has horrendous side effects, and especially when you're in a vulnerable position like that, I thought I was taken advantage of in a way. So essentially, when they sell a Mirena IUD, they do get part of the profit, right? As doctors, if you sell certain devices or certain items, and we know this with the drug pharmaceutical companies too, they will get part of that. And so part of me didn't trust my provider in that sense, but it's everybody I've ever been to. So I suggest that if you are going in for a biopsy for something, whether you think you have endometriosis or something like that going on, if you have, heavy bleeding, heavy symptoms, that you just go in and prior, and you stand like in your convictions as to whether you want to get an IUD or not, because I wasn't prepared to be sold something while I was splayed out on the table. So I did feel a little taken advantage of. And I was telling Vanessa the other day that because of the bloating, I'm having a hard time fitting in my pants. And yes, it is not just food. So basically my stomach feels as though I'm pregnant. It's so distended, and my cramping was so severe for the first couple months that I almost got it out. And I couldn't essentially do it on my own. So now I'm in the waiting period. So I'm decided I'm going to wait another month. And if the bloating subsides, I might continue with it. But essentially, if you have any pain at all, if you have any type of IUD, whether it's the copper IUD or the Mirena IUD, you need to ask for an ultrasound. Ask your family doctor, ask your gynecologist if it's a wait. Get in as soon as you can, because I was talking to my ultrasound tech, and when I told her I got it put in, and she said I would never put one in my body, because I've seen so many women who it has traveled and it's perforated their organs. So just so you know, it doesn't happen to everybody. I know about 5 different women in my life who said they've had really good experiences. They've had it in for 5 years to 10 years. And then I've also read and heard, I've looked on TikTok, I've read online, that there are stories of women who have had to go in for surgery. Their bleeding never does stop. There's just so many severe things that can happen to them. And one of those things being severe anxiety. And that's something I've noticed prior to getting the Mirena. I was feeling more balanced. I don't know if we talked about this. And then I got the Mirena put in, and it kind of messes with your hormones. So I've been having ups and downs, and it's balanced out a little bit now. I'm getting closer to 3 months, but my bloating all of a sudden just went like crazy huge. So I have to be super mindful, which isn't a bad thing, of the things that I'm putting into my body, or I will bloat. What about for you when it comes to, like, I don't know, getting your biopsy and then, or thinking about, I guess, the pill? I know you mentioned you were on the pill before. Like, what were some of the negative side effects that happened to you?
I don't remember. Well, like I said, I was on the pill like 20 years ago. And then I just stopped because I wasn't able to really get pregnant. So I didn't really think it was something that I needed. And I know that it cannot be a good thing, changing your hormones and all that. So I chose to not. I did go on it, I guess, when I first started dating my husband. And then I went off of it again right away, just because I didn't feel bad. but you could tell that like there were some things that just made you feel off. So I quit taking it as well. But
you did, yeah. And that was my preference after having my daughter, was to go off. But I do hope, I'm still hopeful, because I still have the Mirena in, and so in order to go get it, I can't remove it myself. You can if you can feel the strings, but unfortunately I can't. We might be too intimate, but I can't. And so I will have to book in, and there will be a wait for me to get it out of my body. And so for people who have had even more severe reactions to me, like the weight gain, the anxiety, some people get so depressed, they, you know, like they're at that stage where they're like, I can't have this in my body anymore. It can wreak havoc on your gut biome. So the bacteria in your lower gut, and then it can cause all sorts of digestion issues. You might have trouble with constipation, things like that. So actually, you know, we think about it as like, this is one of the only things being pushed to women who are dealing with female issues, like, you know, all of these things that come down the pipe, and they're pushing these devices that can also do more damage than good. And so for some people, they just have to put up with this because there's no alternative option, right? Other than surgery. And surgery wait times can be up to a year, or sometimes more, sometimes 2 to 3 years, because they always want you to try these options first before going the surgical route. A, because they're so backed up, and B, because I don't believe that they always trust in women's pain. So have you ever had an experience where you've been in severe pain and they're just saying, oh, it's just period pain, you'll be fine?
Yeah, probably. Yeah, depending on the doctor, right? Yeah.
It's like you're almost wrote off at times. Like you're just being emotional, you're just being erratic. But I have a really high pain tolerance, and the contractions that I was getting after getting my IUD put in felt like when I was giving birth. So I gave birth naturally to my kids, and it felt similar to that.
Yeah.
And so I had a heating pad, and I was taking pills, and this went on for like a month and a half. Right?
Yeah, that's crazy.
Yeah, and apparently that's normal.
Yeah.
Which is crazy, right?
They tell you just to take medication, pain.
Yeah.
Just take pain pills.
Yeah. Well, and we also were talking about the copper IUD. Now, the copper IUD is great for if you're not wanting to get pregnant, and it has less side effects. So the Mirena actually is putting, is it progestin, I believe, into your body. So it's messing with your hormones, whereas the copper IUD is essentially not doing that. And I was on that prior to having my kids, or in between my kids. And that worked really well, and it didn't seem to wreak havoc on me, but everybody's so unique that you just have to try it, I guess. And it's trial and error, even though sometimes it can be super severe. We were also talking earlier about mammograms, and this is something that I haven't done yet, but I want to, because I have an experience of cancer in my family. So could you kind of explain to the audience like your experience and why you got it, and and kind of what that looks like for people like me who haven't gone?
Well, I've got 2 different types of mammograms, and the reason why I get them is because I had cysts in my breast, so I get lumps. And then we have to check if they're cancerous or not. And my family, I have family history of it, so I have to get checked. And I've been getting checked for like 10 years. So the first mammogram that I had was the typical, you know, get your boobs out, put your boobs on the table. They take like this, I don't know why I have to really show you with my boob. Then they take like this machine and they squish your boob down, right?
Okay.
And then they get the images that way. I don't know. I never found it like super uncomfortable. It is uncomfortable. Obviously, you're having your boobs squished.
Apparently, and this is what my ultrasound tech told me, the smaller your boobs are, the more it's going to hurt. So for a small little bitties, it might be more painful. Yeah.
But so I don't find it too uncomfortable, but I did obviously find it a little uncomfortable. Never feels good. Depending also if you're menstruating, if they're sensitive, right? So there's a lot of different times, but so I've had a few of those done. And then I also recently, my last one, I went in expecting to put your boobs up, and it was different. It was you lay down on a table and they take like this, it looks like an x-ray machine, which I guess it is. And you lay down, you are exposed, and then they push this like thing onto your boob. So they do it on one side, they push down and then they like rotate.
Oh, that sounds horrendous.
And I hated that one more than the other one because where my lumps were, like my cysts, it was pressing on it, but then it was also like moving it.
Mm-hmm.
So I felt, and she was like, and I said, oh, this is different. Like, why am I doing this one? Is it a certain thing? And she said, no, it's just a new device that we got in hopes of making women feel more comfortable in this situation and not as painful. And she's like, and I said, no, like this is fucking worse. And she's like, oh, really? And I said, yeah, it is. Like, to have something pressed down, and it might be, maybe it's better for small-breasted women.
Yeah, I'll let you know when I go.
I don't know.
Yeah.
But I was telling Cass this, and Cass had heard something different too about how that one's only for special things, like for if they, decide to do it. Like it's a special reason why you have to go there. I didn't know. They didn't tell me anything, but the lady just told me that it was a new device that they were trying to make women feel more comfortable. Again, I thought it was worse.
Yeah.
But you can't pick and choose. Well, maybe you could, but I didn't know
that there was
trying
options.
A new thing, right? I don't even know if they have a normal mammogram there, like the one that you stand. But yeah, it wasn't, I think that one's different for all women because all women have different sensitivity in their breasts. They have different nerves in their breast. If you have a cyst, hitting that cyst might feel more painful. Ovulating, if you're breastfeeding, like there's so many different reasons why it could be a different pain experience for you or discomfort for you. I didn't find it that bad. I'd rather have that, except for the pushing one. I didn't mind that. I didn't like that one over the biopsy and the pap shit.
See, that's interesting. And we always kind of, whenever I go in to see my ultrasound tech, which has been regular, she's got a good sense of humor, and we kind of were joking about how, like, if a man had to flop his penis down and get it squished into a device, they'd probably do a little more research into finding something new. And it's funny that the new machine is no less painful than the old one.
But then also, it's funny, and me and the ultrasound tech were talking about this. Men get, when they used to get checked for
prostate,
penis cancer,
prostate
where
cancer.
They had to get the Q-tip shoved up their tip,
okay.
Right? They don't do that anymore because it was too painful for men. All men have to do now is get a blood test done.
No.
Because my husband went in anticipating that he was going to get like either a Q-tip up his
which sounds horrendous.
Or no, maybe it was the fingers up the butt. One or the other.
I have to look into that.
I'll have to ask him. So he went in to do a checkup, and that's what he anticipated. And they were like, "Oh, we don't do that anymore. We do blood work so that you're more comfortable." I'm like, "Oh, it must be nice."
How nice for them.
Like, how come we don't get any of those treatments?
Yeah.
But even tampons. Like, I don't think I've used tampons for 12 years. And I know a lot of women are like, there's no way it'd make me feel too uncomfortable.
It does when you have cysts, especially, I've noticed, and endo.
To have a tampon.
Yeah,
so, I can't do tampons. Yeah. But I had a friend telling me she wears Nicks. And I was like, can you, like, with heavy periods? And she said she can go all day without changing it. And she has heavy periods.
Super uncomfortable, though.
That's what I thought, but apparently you don't feel it.
Really?
So I'll try one.
Oh, that's a great idea. I'll try them too.
Clean it out for me.
No.
Because I think that'll make me sick to my stomach. Cass, can you come change my panties?
I'll do it.
But
call it Curtis.
I'll try. Hey, there's no way in hell that guy would do that.
You married me.
Yeah. So I'll try it and see. Maybe it won't be as bad as I'm anticipating.
I've tried the cup. So I've tried the cup,
like the
Diva cups, and I can't seem to insert it correctly. And I've tried all the different styles and the ways.
I don't want anything up there.
Yeah, it's uncomfortable for me personally, but they say depending on how your cervix is sitting. And so it just seems like all of our options are uncomfortable. And if you're wearing just a pad, it's also uncomfortable, right? Especially.
It is, but I feel more protected. Yes. If I was to wear a tampon, I would probably be wearing a pad as well.
Yeah, me too. Yeah, just because of the nature of our flow. So that was one positive benefit to the Marina, is that I no longer have my period. which is like unheard of because I was having so many issues. I had to go in and get an iron infusion done because my iron was so low. So I have more energy now, so I'm working out more. Yeah, but I also, when you're feeling bloated and just gross, it doesn't help with that either. So I don't know. I think that like with anything that you're going to do, I would suggest to try out your options, do your research, and especially when it comes to like women's like periods and things like that, go all natural. So I found some really great brands that are in the superstore now.
Yeah, I wear cotton pads.
Yes, they have
They're expensive.
They are expensive.
They feel
you can feel the difference.
Yeah.
And that's with the
there's
tampons
no
as well.
There's no like
And there's nothing like when I would wear, just so if I'm traveling and I forgot and I have to go and get some at the grocery store and they don't have, or sorry, at the gas station and they don't have what I can feel the difference. And it makes me feel kind of sick to my stomach a little bit. And maybe that's mentally too, I don't know, but I do notice a difference. And so I would suggest going all natural. And for if you have like
if you can, I know it's expensive.
It is. You do have a teenager though in your house. NICs are a great option. There's 3 or 4 different brands now that I've seen.
Try it.
And some that are less expensive and some that are more. But when you compare them to the cost of tampons and pads, I don't know, you might be saving a lot of money.
Well, I know with my when I buy a big thing of pads, heavy duty, it's like $17, and that's for, and then I have to buy different sizes of it. So you're spending like $50 just for, and that lasts for your one period, which is like 5-6 days. Yeah. So you're spending so much money. But I think there are resources out there too that can help you with getting. I know there's a lot more now.
Maybe we should look into that and we can link it for period products, because I know that especially now in today's economy, money's tight.
Yeah, it's expensive.
Yeah, and it is crazy that we have to pay so much for something that naturally occurs every month. And I do feel like that's a little one-sided too. I feel like companies are always going to try to make money off of you. But if this was something that men went through every month, I'm pretty sure the cost would be less or free and available. And I am saying that with a little bit of spite just because it is so costly.
It is.
Right? Imagine having a house full of women versus a house full of guys. Like imagine the difference in cost in your budget every month.
But men's boxers are pretty expensive nowadays.
That's true. That is true.
You want those really comfy, silky, flow ones. I don't know what this one is. Cup everything nicely. But yeah, we hope that if you're going in for a mammogram, marina, biopsy, some things can resonate with you and help you in that progress of doing that. You're not alone in this. Like, it might be uncomfortable, but know that there's many stories, good and bad. So do your research, do your homework, and reach out to us if you have any questions. Yeah, for sure. Well, thanks for joining us, and we hope to talk to you guys soon. Sending lots of love.